So today topic is pharmacology of estrogen and progestin. Already know, so these are the two important hormones present in secreted in the female. So they are play important role in the regulations of the secondary sexual as well as the primary sexual characters. And as well as so these two hormones, so they are play important role in the development of the body, or the growth and development of the body is mainly depending upon the hormone secreted by the ovaries, placenta, or even the adrenal cortex or some fat cells. Regarding introductions, estrogen is also known as a estrogen, is the primary female sex hormone. It mainly regulates the menstruation and reproductive cycles. Then as well as, so what are the estrogen? They are secreted in the females, so they are mainly four types. That is estrone E1, estradiol E2, it is denoted as E2, then estriol, it is denoted as E3, then esterol, it is denoted as E4. Among four, the E1 and E2 are more potent as compared to E3 and E4, and E4, that is the esterol, it is secreted only during the pregnancy. It is a normal life, it does not secrete, only it can secrete during the pregnancy. The daily output of estrogen in female is 10 to 100 microgram per day, but male is also secrete the estrogen from the fat cells or as well as the adrenal cortex. So that amount is 2 to 20 microgram per day. Okay, so this is the daily secretions of the estrogen in both male and female. The estrogens are mainly synthesized from the androstenedione, then as well as the testosterone is also responsible for the formations of the estrogen or estradiol. Regarding mechanism of action, so estrogen and progestins, so they are acts on a nuclear receptors. Example for estrogen, that is the estrogen receptors, for progestin receptor. So these are the nuclear type of receptor. It means so their location is present in the inside the nucleus. Okay, so they're present in the membrane, nuclear membrane of the cells. So here the estrogen progestin, so they are bind here and they cause the transcriptions of DNA, that is the multiplications of more DNA. So as the multiplications of DNA is increases, automatically the formations of mRNA is increases. So mRNA is responsible for to carry the code from nucleus into the cytoplasma with the help of the M template, that is the M code. So that message or code is carried by mRNA during the transcriptions of RNA from a DNA. So DNA can transcripted into mRNA. So that mRNA, it will be having the certain template regarding the code. So that code is a unique for synthesis of the protein. So that desired protein is required for the development of the body or any other functions. So that mRNA is reaches to the ribosomal RNA. So they are present in the ribosomes, and ribosomes read the message of the from the mRNA template and take the help of the tRNA and involved in the protein synthesis. And these nuclear receptor, estrogen progestin receptors, so they are mainly present in the female sex organs, breast, pituitary glands, liver, bone, blood vessels, as well as the heart and CNS. It means the CNS activities is also depending upon the estrogen and progestins. If any abnormalities or if estrogen and progesterone level is increases or decreases, the mental activities of the female was alter or changes. Then as well as the heart, sometimes they can protect the heart. Okay, so as well as so they are involved in the development of the female sex organs, that is the role of the estrogen progesterone, because so as the protein synthesis increases, the development of the body is also increases. So regarding the pharmacological account, so estrogen and reproductive systems are progesterone and reproductive system. So both hormones, so they are involved in the development of the primary and secondary sexual characters, and as well as so they are involved in the development of the genital organs from the womb to the up to the death. So this is the role of the estrogen and progesterone, and here the estrogen, it's play important role in the proliferations of the endometrium. That is the release of the ovum from the endometrium. That is the role of the estrogen. It is helpful for to causes the menstrual flow. So the menstrual flow, it can occurs under the influence of the estrogen. So that condition is known as the proliferations of the endometrium, nothing but the differentiations of the cells or layer of the fallopian tubes or the endometrium, that is helpful for release of the ovum or helpful for the to cause the menstrual flow. Okay, so estrogen in continuous administration externally, it can suppress the FSH and LS secretions. So due to that, the infertility can be occurs. Then as well as the estrogen in the male, so they are inhibit the spermatogenesis, and as well as so they are inhibit the androgen secretion. Means so estrogen, if it is more secreted in the male, it can causes the infertility in the male due to inhibitions of the spermatogenesis or inhibitions of the androgen secretions. So and as well as so the estrogens, so they are mainly suppresses the lactations without altering the prolactins levels. Okay, so estrogen, it can mainly suppresses the lactations by acting on the mammary gland, but the prolactin level is cannot be altered. So then as well as so these estrogen progesterone, so they are play important role in the development of the secondary sexual characters along with the organs. The next regarding metabolic actions, so both estrogen and progesterone, so they are enhance the protein synthesis. So as the protein synthesis increases, the development of the body is increases or organ development is increases. So like that estrogen and progesterone, so they are play important role in the development of the body by enhancing the protein synthesis. And here estrogen have one beneficial effect, so it can increases the HDL, that is high density lipoprotein and triglycerides. So these HDL, so these are the beneficial fats. So they can avoid the congestive heart disease. So due to over secretions of estrogen, it can give the protection to the heart by enhancing the HDL and triglycerides. And other side, the estrogen, it can decrease the LDL and fat depositions. It means the estrogen can avoid the development of the atherosclerosis, or it can avoid the coronary artery disease, or whatever the heart disease are there that can occur due to accumulations of the fat. So that can be avoided by estrogen, because estrogen, it is having the beneficial effect to enhance the beneficial protein like HDL and to decrease the harmful protein like a LDL, and as well as it can avoid the fat depositions. But the progesterone, it can show the opposite actions. Progesterone, it can enhance the LDL and decrease the HDL. If the progesterone secretion is more, means that woman is become the fatty, or so that woman suffering from the atherosclerosis or depositions of the fat in the blood vessels. For dear students, for example, so before marriage or before the pregnancy, the women are healthy or they are slim, because so that is the rule of the estrogens. Okay, so because it can decrease the depositions of the fat, but after pregnancy, so progesterone, it can favor the pregnancy. The progesterone, it can helpful for the pregnancy or to helpful for to maintain the pregnancy in the women's. So same progesterone, it can enhance the fat deposition and enhance the LDL and decrease the beneficial lipid like a HDL. That's why, so after pregnancy or labor, the woman's become the fatty, or that lady may be suffering from the overweight, or maybe suffering from the atherosclerosis or any heart related disease. So that's why, so after the laboring, you should be clear your plasma, or you can always go through the aerobic exercise, so that can normalize the fat content in our bloods or in our blood vessels. Okay, so that is the role of the estrogen and progesterone regarding the metabolic action. So progesterone, it is having the beneficial effect, it can increase the HDL. Then progesterone, it having the harmful effect, it can oppose the beneficial effect of estrogen by decreasing the HDL and enhancing the LDL. And regarding the fluid balance, the estrogen progesterones, so they are mainly causes the retentions of sodium and water. So due to that, the blood pressure is increases, or they are play important role in the regulations of the water. And as well as the estrogen progesterone, they can increases the cortisol and SHBG, that is sex hormone binding globulins. So their level was increases under the influence of estrogen and as well as the progesterones. Then regarding on the GI tract, so estrogen and progesterone, they can decrease the GI motility. So due to that, they can cause the constipations, and as well as they can increases the cholesterol in the biles. And regarding cancer, estrogen, it is mainly causes the cancer, but progesterone, it can oppose the cancer effect of the estrogen. So it means the woman's having the both hormones. So the estrogen, it is responsible to cause of the cancer, but the God giving the another hormone beneficial, that is the progesterone, it can oppose the carcinogenic activity of the estrogen. So that's why those women, they having the balancing concentration of estrogen and progesterone, they do not suffering from the cancer. If progesterone level is decreases and estrogen level is increases, means so that woman is suffering from the memory cancers or memory gland cancers or many other type of cancer. So that can caused by the estrogen, because estrogen, it will be having the carcinogenic activity, but the progesterone, it can oppose the carcinogenic activity of the estrogen. Regarding the lung functions, so they can promote the lung functions by supporting the alveoli. So that's why in the current today, so the COVID is occurs more deadly in the menopause women, so not in the fertile women. Okay, so where the woman suffering from the menopause or the menstrual cycle was stopped, so that woman only do not recover from the COVID, because so they do not have the sufficient concentrations of the estrogen, because the estrogen, it can support the lung function by supporting the alveoli. So that's why they can improve the respiration and the rate of respiration. But the menopause woman, they do not have the sufficient concentrations of estrogen and progesterone. So were already the lungs functions are weak. And in the COVID, once again the lungs functions are weak. So that's why there is a more risk in the menopause women, so as compared to those women having the menstrual cycles. Okay, so next regarding the on the bones, so they are reduce the bone resorptions, that is a release of the calcium from the bone by activations of the osteoclast. So these the estrogen progesterone, they inhibit the activations of the osteoclast. So due to lack of osteoclast activity, the calcium do not release from the bone. So due to that, the bone formation can be increases. And estrogen, it mainly causes the fusion of the epiphyses. So epiphyses is a cartilage, it is present in the top of the head of the long bones or bones. So these epiphyseal cartilage play important role in the absorptions of the minerals from the blood and involved in the development of the bone. But the estrogen, after starting of the menstrual cycle 1 to 2 years, it can cause the pause or sealing of the epiphyseal cartilage. So lack of epiphyseal cartilage activity, the height of the bone is decreases, not decreases, stopped or paused. So due to that, after the starting of the menstrual cycle, the woman's height can be growing up will be the stop. That is only due to the causing of the epiphyseal cartilage pause. So here the estrogen, it can causes the paucity or pause of the epiphyseal cartilage. Due to that, the height growth can be stopped. Okay, so estrogen progesterone, so they are enhance the generations of the vitamin D3, okay, by causing the inductions of the renal hydroxylase enzyme. So this enzyme is responsible for the release of the coleotrials from the kidney or from the distal collecting tubule, that is required for the synthesis of the vitamin D under skin when we are exposed to the sunlight. So that's why, so before the menopause, the woman do not suffering from the osteoporosis. So when the woman after 45 years, when she is suffering from the menopause, then gradually the woman is also suffering from the osteoporosis. So that's why my advice is, so in any your mother, father, then sisters or any neighbors are there, if their menstrual cycle was stopped due to, that is a crossing the age of 45 years, so where you can give them the advice regarding to take the vitamin D, because otherwise they will be suffering from the osteoporosis, because estrogen is a lack in the menopause woman. So due to lack of estrogen, the vitamin D3 does not generated. So that's why, so the menopause woman commonly suffering from the osteoporosis. Regarding pharmacokinetics, so these are administered orally, but they can easily undergo the first pass metabolism, both estrogen and progesterone, without showing any action. So they are enter in the liver by first pass metabolism and undergo the metabolism. Due to that, their activity was decreases. So that's why they are given intramuscular. So both estrogen and progesterones, so they are well distributed. So they are highly bound to the SHBG, that is a sex hormone binding globulin, as well as they can bind the albumins. Then, so they are metabolized in the liver and followed by conjugated with the glucuronic acid and sulfate. So after metabolism, the estrogen progesterone, so they are excreted through a urine and as well as the bile. And regarding ADR, so due to estrogen over secretion, it can causes the libido. Okay, also it can produce the gynecomastia, then feminizations when given to the males. It means the male characters become the female. So when estrogen is given to the males, so these are the ADR of the estrogen, and as well as it can causes the that is a fusion of the epiphases and reduce the adult sutures, then as well as it can causes the migraine and epilepsy as a area. But when you are giving the fixed dose of the estrogen and progesterone, it can avoid the epilepsy. If any alteration, if the excess of estrogen and progesterone, it is responsible for to cause of the migraine and as well as the epilepsy. Regarding therapeutic uses, so these are helpful for the treatment of the common use for the hormone replacement therapy. So where the woman suffering from the infertility, so due to lack of estrogen and progesterone, so where they are given the hormone. So that therapy was known as the hormone replacement therapy. Then as well as, so they are commonly used for the treatment of the senile vaginitis, the treating the atopic vaginitis that occur in elderly women. Then as well as delayed puberty in girls. So on that time also, the doctor they can administer the estrogen and progesterone to causes the start of the menstrual cycle. Then as well as it can use for the treatment of the dysmenorrhea, then acene, then as well, because the low secretions of estrogen, the female they are suffering from the acnes, one type of the skin allergy. So they are suffering from the females due to low secretions of the estrogen. So that is also treated with the help of the administrations of the estrogen. Then as well as, so they are helpful for treatment of the dysfunctional uterine bleeding. So that is a progestin is given cyclically in the rational and effective therapy, but estrogen is a adjuvant drugs, but that can treated by progesterones. Then as well as, so these are used for, are especially estrogen, they are used for treatment of the carcinoma of the prostate in the male. So male, the over secretions of dihydrotestosterone, it can causes the prostate cancers. So that prostate cancer is treated with the help of the administrations of the estrogen. So these are the therapeutic uses of the estrogen and as well as the progestins. Okay, have any doubt?